Now, in the past couple of episodes, we've been gaining a greater understanding of what polycystic ovarian syndrome, or PCOS, is and how it can impact female health. Today, we'll be taking a closer look at medical interventions as well as lifestyle changes that will help in managing PCOS, and we'll also be highlighting the importance of a holistic approach in this condition. So joining me again is Dr. Mark and Sister Elise, and they are from the T Clinic. So Mark, I guess the question is, can PCOS be cured?
Michael, it's simple. No, it's a lifelong disease.
Right.
The crux about it is it's manageable, and it should be managed, because if not, it leads to problems later on in life.
Okay. Now, Elise, in terms of beginning some kind of management or treatment of PCOS, I mean, the first step is to get it noticed, diagnosed or recognized. So where is the disconnect? Because as we've mentioned in previous discussions, it doesn't seem to be something that's immediately diagnosed. Sometimes people struggle for years and then are only later diagnosed with this, and it's not a difficult diagnosis.
Absolutely not a difficult diagnosis. I think it's important for people to know what the symptoms of PCOS is. And if you have irregular periods and you have excess hair and you are prone to acne, then that should be the first signs for you that there's a
definitely weight gain as well.
And weight gain.
Okay.
Yes,
Okay.
that there's a problem.
And now, in terms of managing it, I mean, does it have to be medical interventions, or is it lifestyle first?
Michael, I love that you asked that question. The cornerstone of managing polycystic ovarian disease is lifestyle changes, and these are things that you can incorporate at home.
Okay.
So if we look at what the driving force behind polycystic ovarian disease is, it's all about a dysregulation in male hormones and female hormones. So dysregulation in your androgens versus progesterone and estrogen. And the driving force behind that is insulin resistance and inflammation. Mm-hmm. So therefore, manage your insulin levels, bring them down, and manage inflammation. So that addresses not only the signs and the problems that is associated, like insulin resistance, weight gain, etc., but in addressing those, lowering inflammation, lowering insulin levels, you also reverse the other signs, like the irregular periods, the excessive hair growth, the weight gain, the acne. So it's all about healthy lifestyle.
Okay.
So we need to exercise at least 30 minutes of moderate to strenuous exercise per day.
Right.
And for those people who have never exercised, you start with walking for 30 minutes a day. Mm-hmm. It's not a lot. And this is 30 minutes on top of your normal activity. It's not, but I walk a lot at work. Sorry, that doesn't count. It's on top of that. And then diet, very, very important. We need to have a diet rich in whole foods and low in inflammatory components. Okay. So on this program and on so many others, we always talk about the Mediterranean diet, rich in whole foods, fish, vegetables, fruits, legumes, grains, etc. Get rid of sugar, get rid of the glutens, get rid of bread, and those kind of stuff. Okay. Limit alcohol. And you know what? Immediately inflammation starts improving. This is basically treating your gut. Yes, when we take a look at the medical side of stuff, it's all about that as well. Lowering the androgens through certain medication and lowering inflammation. Okay. And that leads to weight loss and regular periods.
Right. Now, Elise, is it, if you make all these lifestyle changes and you get the treatment, but then you feel better and then you stop, are you just going to revert back into the condition where you've come from?
Absolutely. It's not a curable disease.
Right, right.
It's mostly genetic. If your mother had it, you most probably will have it as well.
Okay.
Yeah.
And what about the emotional side? And I'm going to ask you first, Elise. Mark, you can add on to this. But as a woman who's dealing with all of these symptoms and this condition, I mean, how heavily taxing is the emotional side of things?
I think I want to start by the hormonal imbalance that there is. We all know, we've spoken about menopause and what happens with that. We've spoken about PMS. We know if the hormones are out of balance, then it affects your cognitive behavior as well as your mental clarity, mental health, etc.
Right.
So it needs to be managed as well.
Okay.
Talk to somebody. Get somebody that knows about this. Don't keep quiet about it. What these people are prone to doing is they go into themselves, they retract because they already battle with the physical changes. Yes. Now it exacerbates the anxiety as well as the depression.
So we can spot a teenager with polycystic ovarian disease very, very young. We can actually, when we talk to our patients, we could have identified them in primary school.
Oh, wow.
So they're a little bit taller than all the other girls.
Okay.
They're bigger, heftier, and they're a little bit hairy. So immediately from school, they're teased as the big plump girl or the big fat girl.
Right.
And then when they hit 15, 16, and they're not menstruating regularly, all the other girls are doing it, it already starts creating problems. Mm-hmm. But growth then for them slows down. They don't get taller, they get wider.
Okay.
Now, let's say that you get into a relationship and you're just newly married, and we haven't identified your polycystic ovarian disease, and you try and fall pregnant, and nothing is happening. Mm-hmm. It puts strain on you. There's that doubt, there's the resentment, I can't have children,
yes.
or I'm battling to have children. And you know what, these things are addressable if it's recognized earlier.
Okay. I think another question that is intriguing me now, because you've spoken about the obvious signs and symptoms. Are there people who are dealing with this condition which have less of the signs and symptoms, but they only then recognize it at the point where they can't fall pregnant or they're struggling on
Absolutely.
Absolutely.
Okay.
Absolutely.
So
not everyone will have the overt physical changes.
Right.
So you can have polycystic ovarian disease and have a period every now and again, but you know what, you don't necessarily have to have the hirsutism or the acne or the weight gain and still have irregular periods.
Okay.
And that then leads to a problem. Remember, it's not just about ovulation. Women with polycystic ovarian disease or syndrome can fall pregnant, but they have less success in carrying a pregnancy full term.
Okay.
And there's also higher risk of abnormalities and premature births with us. So, you know, a lot of women only get diagnosed once they either can't fall pregnant or they start losing pregnancies.
Okay. So Mark, having discussed all of these aspects, what is actually the process in terms of medical intervention that would be implemented?
Michael, I think it all depends at which stage of your reproductive years this disease is diagnosed. If it's young, I would say that oral contraceptives to create and regulate a period for you on a regular basis would probably be the starting point. Remember, if we don't ovulate, we cannot menstruate. And if there's prolonged periods of no menstruation, the endometrium becomes a little bit thicker, and that increases our risk for developing endometrial cancer. Okay. So your contraceptives to regulate the period. The next one, I would say, is managing and sensitizing the body to insulin. And here we look at the box standard treatment that's been on the market for so many years in the form of metformin.
Okay.
Okay, so lower the insulin levels. There's also other medications available. So to treat overt signs of hirsutism, etc., we can use some of our diuretics. They're specific and they help with this problem. And then also lowering androgen levels in the body, the male hormones in the body. And here we're looking at medication that's usually used for hair growth.
Okay.
So the hair growth tablets with the active ingredients like finasteride to dutasteride not only lowers DHT, but they also help with hair growth for the women, because one of the signs of polycystic ovarian disease is male pattern baldness.
Okay.
So you can lower it like that as well.
Right.
And then we look at supplementation, things like saw palmetto, which works quite well, also anti-androgen, and your essential minerals like iron, because polycystic ovarian disease or syndrome is associated with iron deficiency. We look at other anti-inflammatory kinds of minerals like zinc and magnesium. So, you know, there's a lot of lifestyle changes, supplementation that we can use. Vitamin D is also important.
Very important, yeah.
All right. Mark, somebody who might want to find out a little bit more, remind us again where they can get hold of you.
The T Clinic here are based in Bryanston, Johannesburg. The number is 010-824-1393. We do consult with people all over South Africa, as well as internationally. You can also get hold of us via our Facebook page or contact us on the T Clinic website.
Wonderful. Mark, Elise, thank you so much. I think we've done a pretty good job at getting to the bottom of this condition and hopefully given a lot of hope to ladies who might be dealing with. So
Thanks,
thank you for joining.
Thank you, Michael.